The three children received the medication between January 3rd and 4th, 2019. On January 5th, the doctors became aware that the medication was administered incorrectly. Within hours of receiving the medication, the children started to experience strange symptoms and cried out for pain in their legs and arms. They all became paralyzed and were placed on life support until their deaths. Chairman of the hospital's board of directors, Dr. Cassandra Alls, addressed the media at a press conference Friday.
Over the period 3rd to 4th January 2019, 3 young patients were treated for leukemia at the Georgetown Public Hospital Corporation. These patients were treated by the same team of medical doctors and were administered the drugs vincristine and methotrexate. Subsequent to the administration of these drugs, all 3 children suffered adverse reactions, which became known to the medical staff on or around the 5th of January 2019.
The 3 doctors who were involved in administering the treatment to the children were subsequently sent on administrative leave on January 29, 2019, pending the outcome of the investigation.
That report concluded that human deficiencies and systemic challenges contributed to the demise of the three children.
The doctors remain on administrative leave, and the decision as to whether they will be fired lies with the Medical Council of Guyana. Meanwhile, Dr. Karen Gordon Campbell, Deputy Chief Medical Officer, explained what happened.
The scenario that we were able to put together was lack of staffing and the few persons that were available stretching themselves between clinic, accident emergency, ward rounds, and administration of the chemotherapy led to the administration of the chemotherapy being done without the senior person being present at all times.
The protocol states what dosage to administer based on the child's weight and wear.
One drug was administered intrathecally when it should have been administered intravenously.
The hospital board met the family of the 3 children on Friday morning to formally inform them of the findings of the report.
And what we learned from this incident is that it's very important for us to have our staff better supervised, juniors by seniors, and that they stick to standard protocols for the management of all pathology within the institution. Not only the management of or the use of chemotherapeutic drugs, but any protocol. Even if you're going to do a surgical procedure, if you're going to do any form of management, protocols are there and they are there to be followed.
On January 14th, the first child, 7-year-old Corwin Edwards, died. Then, 4 days later, it was 3-year-old Rushni Sigobin of Enmore, East Coast Demerara. In another 8 days, the third child, 6-year-old Sharizer Mendoza of Queenstown, Essequibo Coast, died. Reporting for Newsroom, Isanella Patwa.